What goes on in your mouth is directly connected to what's going on in the rest of your body. So I think it's important to look at ergonomics from that standpoint. You know, that when we lean to one side or we bend or twist, it isn't just that body part. It's affecting the whole anatomic kinetic chain from the head to toe.
We need to be paying attention to this because we can injure ourselves in school. And I'll tell you what, it is a lot harder to unteach a bad habit than it is to learn it the right way, learn how to take care of yourself, and get out of school and be able to carry on from there.
Potentially you might have something that you can change at work, and it might be some simple changes even, and even that might be just a simple, taking a video and a picture of yourself or your workstation and say, hey, what can we do differently here? So I would definitely recommend that. I think that's honestly a very easy way of just looking at what you can do differently for yourself.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists. This is your student-focused roundtable for the month. I just wanted to give a quick plug for Q Optics. Yes, they are sponsoring the show, but I also want to let you know how easy it was to work with them. We met with them in Chicago at one of the big conferences called Chicago Midwinter. And right there on the exhibit hall floor, they walked me through all of the necessary steps to be able to get really dialed in for a good pair of loops. Now, I've always been skeptical of loops, and my experience with Q Optics really changed my point of view on loops. So if you're thinking about it and you have the ability in the program that you're in to have Q Optics come in, make sure you guys reach out. You won't be sorry.
Let's get into the Student Focus Roundtable. So at the beginning of the Student Focus series, this was your brainchild last year in 2019. Isn't that the year? Gosh, they're flying back.
It's the beginning of 2019. We're like, look, the students need a little bit more direction. We really value that. Like, we're so impressed you guys are even listening to this. Let's be honest.
So true. Yes.
So let's give them something. They're taking the time to listen to us. Let's give them something that they actually could use.
And you came up with the idea of a roundtable, and we brought on different people that would talk about one particular topic. And then I kind of hijacked it for 2020 and made it a little more researchy because that's what I do. But I hope that you guys find it helpful because what we're aiming to do is bring on people who understand the topic and let them explain to you how they're looking at research and applying it clinically. Because what happens is we graduate with the knowledge we graduate with, and it might be a little, I don't want to say up to date. It might not be as up to date because they had to get you graduated, right? But there's stuff on like HPV that, it's ever changing. And so we got to stay on top of that. And so we're going to bring the experts on so that we can teach you how to read the research and apply it to your patient care. So you can always be doing that up-to-date evidence-based clinical practice that we talk about so much. And we hope you enjoy this student-focused episode.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
Well, listeners, I'm super excited about this series this month, and we're going to kick it off with an awesome student roundtable. It's going to be about ergonomics, and it doesn't get enough love because some of these states don't say that it's CE worthy, so people just don't go to the courses. But that is, I think, very egregious as a clinician because this is what's going to keep you in it. So if you're a student, you've spent the time to learn and really hone those fine motor skills, yet you want to make sure you have some longevity in this career. So I want to welcome my guests, Emily, Lancette, and Ward, and I'm going to let you each introduce yourselves individually. Emily, I'll let you go since you're the solo one over there.
Hi, I'm Emily Boge. I am the Dental Administrative Chair at Hawkeye Community College in Waterloo, Iowa. And I am the Program Chair for Dental Assisting and the Program Chair for Dental Hygiene.
That's awesome. And you've heard Emily lots of times on this podcast. So welcome back.
Thank you.
And this cute little couple over here is like a little power team. Welcome.
Hi, thanks for having us. This is our first time on this podcast. I'm Lancette Van Guilder. I have been a practicing dental hygienist for about 25 years. I currently still work part-time in private practice. I travel across the U.S. as a continuing education speaker. I do a lot of courses on ergonomics. My husband and I have a really awesome one we do together, where we incorporate, the dental office and physical therapy. And I also own and operate an independent mobile dental hygiene practice in Reno, Nevada. I'm passionate about ergonomics because I've invested a lot of time and effort to practice healthy. And I'm happy to say that after 25 years, for the most part, I still am working pain and injury free. And I do owe that to my amazing physical therapist husband.
Hello, amazing physical therapist husband.
Hey, thanks for having me as well. I'm Ward. I'm a physical therapist who specializes in occupational health and wellness. I work for a national company and have spent the last couple decades working with industrial or workplace athletes, including dental hygienists. I currently oversee a large team of specialists that includes orthopedic surgeons, physiatrists, hand surgeons, even psychologists. So, and actually we have a large team that I work with, about 250 specialists that I work with. And I'm definitely happy to discuss this ergonomics research and help dental hygienists and prevent pain and injury.
That's awesome. Well, thank you very much for coming on. So what we try to do at the student roundtable is present research, and as practicing clinicians, how do we take that research and apply it clinically? Really trying to get that ball rolling for critical thinking, because what we learn in school, it's great, but it's quickly evolving. And so staying up on research is so important. But there was one thing that we talked about in our correspondence was there's not a lot of research around ergonomics. Is that true? Do I understand that correctly?
Absolutely true. There are some really big gaps. And that's why I picked the article that we're going to talk about today, is because it is a tiny, tiny little fish in a big sea of research that really talks about lower body ergonomics. So our article is actually going to talk about the feet of dental hygienists.
Ooh, well, let's get into it. Let's start with you guys then.
Okay, awesome. Well, the research that Ward and I decided to talk about today is about how dental hygienists with poor work posture may develop muscle imbalances, including our feet, believe it or not. So this research article explores how poor working posture may lead to changes to our gait, which is how we walk, and even how we place weight on certain parts of our feet, especially after a long week of work. We know that these disturbances may even lead to problems with physical balance, which ultimately puts dental hygienists at a higher risk for developing a musculoskeletal disorder. I want to start off by saying again, reiterate what you said, Michelle, is that there is really not a large body of evidence regarding dental professionals. There's some, but there's some big gaps. So for any of you students out there that are considering a career path, we need researchers, and we definitely need more research on ergonomics and musculoskeletal health, specifically for dental professionals. So the topic that we kind of talk about as we go around and give our courses on ergonomics is how the whole body is connected to each other, right? And dental hygienists should understand that, because we're talking about that with our patients with the oral systemic link. What goes on in your mouth is directly connected to what's going on in the rest of your body. So I think it's important to look at ergonomics from that standpoint, that when we lean to one side or we bend or twist, it isn't just that body part. It's affecting the whole anatomic kinetic chain from the head to toe. So this, I love this article because it's just one little piece of research that we have come across, really kind of talking about how when we put our bodies in these, awkward positions, that it ultimately could lead to disturbances with how we walk and our balance, which could put us at a high risk for injury. So traditionally, research for dental professionals focuses on the upper body and limbs, like things like carpal tunnel syndrome, neck and shoulder impingements. But in reality, the entire body is connected by nerves, muscles, joints, blood vessels, and ligaments. So when there's muscle imbalances in one part, it ultimately causes the chain reaction in other joints from head to toe. This article does reference other articles that also have looked at discrepancies between height differences in our shoulders and our hips in dental hygienists and healthcare workers in general. So those are other examples that kind of go along with us looking at the foot. So this research article discusses how, we lean forward, we twist to one side, we stay there for long periods of time. we actually are changing how we're distributing our weight on parts of our feet. This research primarily looked at right-handed dental hygienists, different BMI, different age, different lengths of time we've been practicing, and they didn't really find big significant differences there, although other ergonomic research may indicate that the longer dental hygienists are working, the more at risk they are. But this article did not identify that. But what they did find was that plantar imbalances and gait disruption was more evident after working a full week than just working one day or at the beginning of the week, and that the analysis showed significant differences between the right and left foot. And Ward can talk a little bit more about what that means and the gait part of the assessment.
Great.
So gait analysis, or observing how a person walks or a subject walks, and gathering that information can be done in a variety of ways, from simply observing to using technology to record data on joint angles, and pressure placed through points of the feet. In this case, pressure was measured for different points on the feet, and we found that there was, from the beginning of the week that the individual was working to the end of the week, that there was a larger amount of pressure on the individual's right foot and the forefoot. We don't know exactly why there was a change in pressure in the distribution of the foot when gait was assessed, but it does open up opportunities for follow-up research. Changes throughout the week leading to increased pressure on the forefoot could be the result of a hypertonic gastroc muscle, which would limit the dorsiflexion during gait. And again, dorsiflexion is just as your toes come up towards the ceiling if you're standing there. So that's that dorsiflexion. If you don't have that motion, you're going to place more pressure on that. During my observations of hygienists at work, I've seen weight shifting anterior into the right side of the body in sitting, resulting in increased weight bearing on the forefoot. This increased activation of the gastroc soleus could result in this forefoot gait pattern rather than a heel contact type gait. And then changes in the hip rotators from sitting in an abducted position may also result in a change down the kinetic chain, causing increased pressure on that forefoot during gait when it was being analyzed as well. So those are a couple examples of things that might be affected when hygienist is obviously sitting down at work and not necessarily walking. But
So I have some questions, and Emily, please chime in if you have any questions. But my first two thoughts that popped up when you said feet, I was like, was there any difference if someone stands versus sits? Do you think that would matter?
It could, but you think about the idea of we have a base of support, right? So when we stand up, our feet being closer together, and then we have a cone of stability. And so as we stand up, we're working within what we call a cone of stability. So if you lean forward, lean backwards, and if you start to fall over, then you know your limits of your cone of stability, right? So the pressure changes, but if you're standing and working, your base of support is smaller than if you're sitting and you have a 5-pegged type legged stool along with your feet there. Your base of stability is quite larger, and it allows you to have a little bit larger cone of stability so that you're not falling out of that range, which again is all related to muscle activation and what's kind of keeping your body upright during the time that you're doing your job. And again, it also it relates to the muscle energy and expenditure being used when you're doing a job too, which also can limit or be related to the muscles being exhausted or tired during the time that you're sitting or doing your work. So yeah, it's all kind of all related.
I think a good example too would be like hairdressers, right? They're on their feet all day long. Well, they have a whole other slew of ergonomic issues.
Exactly.
So standing all day, probably not so great. Sitting all day, complicated. Probably the goal of, I think, ergonomic training and education is neutral working position, right? To avoid the bending, twisting, leaning, and, investing in education and training and ergonomic tools that help us not be able to, do these bad habits that we all kind of are guilty of at times.
Right. And so that's what we're teaching students. And I feel like I'm just not, I'm not nearly as smart as you guys. I just keep hearing you talk about muscle movements and all this stuff. I'm like, I got nothing on that, man.
I was like, I got the flexion part. I was like, I remembered that.
Yeah. I was like, whoa, wow, this is off the train for Boge here.
I think, how this really, really translate into real life practice, whether you're a veteran hygienist going back to work or you're a new graduate is, it is awareness that this study also showed that 87.5% of dental hygienists had poor working posture. And the mean REBA score was 4.96, which shows that the vast majority of dental hygienists do not work in a neutral position. So me personally, practical implications, I've spent a lot of money and time in ergonomic tools, saddle stools, lighting, loops, cord management systems. I'm trying to go cord and rheostat free whenever I can to help keep my, more neutral alignment. So awareness and self-assessment. And even though you don't maybe have researchers there, evaluating you, have your coworker, videotape you for a little bit, or have a physical therapist or an ergonomic specialist or somebody come in and really see, where are you at? Because even me, who has really paid attention to it for 25 years, every time Ward comes in and gets his teeth cleaned, believe me, I get reminders, hey, I noticed you're doing this or you're doing that. So continual education, investing in some of these great tools that we have. And the goal of, all this education on ergonomics is how do we just try to stay in a neutral position as much as we can.
Changing that position when you can and going for that neutral position is the ideal. But we realize that when we're observing dental hygienists in their job, it's challenging at times. You can't always find that perfect position. You're still using forces that wouldn't normally be recommended. And some of those things are unavoidable. So that's when okay, these are the muscles that I need to strengthen up to make sure that I can actually do my job in these awkward positions a little bit, or use this force that I need to. So some of that strength training and education on different types of exercise overall for your body is something that also to look at.
And that's where I was going with it's this interprofessional education is so important. And I love having the ability to just soak all this up, you guys talking about this, because we're trying to teach the students that neutral seating, but at the same time being active and agile and have dynamic. Because what I notice a lot in clinic when I read that Kim and colleague article that you had sent prior to this meeting was that the students put their feet on their chairs a lot. Even, our clinic, we have, 18 saddle chair at every single unit. They're propping their feet up on those casters. And this just totally, what Lancette and Ward were just talking about, totally supports the reason why they need to have their feet planted on the ground so they can be dynamic. So they're not one of those, 87 some odd % people that are injured. I don't know. I can't thank you guys enough for putting that message out there, because the interprofessional collaboration that you guys have as a couple getting out there and putting that message out there is so powerful.
Thanks.
And I would say, if you're a veteran hygienist, get a student to shadow you, because they will point some stuff out. I get called out constantly by students. They're like, oh, Miss Strange, do you know that you crossed? I'm like, yeah. Do as I say, right? I'm trying to get this calculus off. I always go into those bad habits when I'm focused too.
Do you know how hard it is to get these ergonomic practices into the school? As a program director, I'm fortunate that I have an upper administration that listens to me, that says, we can't just buy the cheapest glove on the market. We need a glove that's going to support the clinician's wrist, because we don't want you coming out of school injured. And if I have one thing to say to the students that are listening, it's that you need to advocate to the people who make the decisions. You need to say, I've been reading in the magazines, I listened to a Tale of Two Hygienists podcast, and we need to be paying attention to this, because we can injure ourselves in school. And I'll tell you what, it is a lot harder to unteach a bad habit than it is to learn it the right way, learn how to take care of yourself and get out of school and be able to carry on from there. So, you have to advocate for yourselves. And sometimes that means buying your own equipment. Unfortunately, as a student, you're kind of held to what the school has, because we have to keep all the students on the same level. But it's not that much more money to buy.
I've purchased all my own ergonomic tools and equipment my whole career for 25 years. You are a good investment, invest in yourself, invest in your health. And, I would be devastated if tomorrow I went to work and I had a back injury or a neck injury or a knee injury that would end my career. I would be devastated. I absolutely love being a dental hygienist inside and outside the op. And, we want a healthy work-life balance. And these are good investments that will set you up for a nice, long, healthy career.
Yeah. And I don't want to be a pessimist, but you might not stay in your practice. So if the doc bought your ergonomics,
you are not going to stay in your practice. You are going to try.
You're probably going to move, and you're not going to take that stuff with
or
you.
Be
but
like me and start my own practice. You could do that too.
Exactly.
I was actually very fortunate to work for someone who did supply me with pretty much whatever I needed.
That's great.
And I thought everybody had that. And then, because I never got out of my op in Iowa, I worked with a lot of other hygienists, but we were all like that. Like if we needed something, we asked, and if we could justify it, he'd be like, by all means, you guys make my practice. And so I assumed everybody was like that. And then I got out there and started meeting people nationwide. I was like, what do you mean? You can't, what?
Yeah.
So I was clueless. I'll be the first person to admit it.
We work with some large companies and that we meet with on a quarterly basis to discuss their work-related injuries and what we can do better, what they can do better, talk about the results, the cases that we do have open with them, case durations and things like that, types of injuries that they're getting. So we kind of cover a lot of that stuff. So it's nice to hear when you have a small group or a small business that's trying to do some things to help their people to avoid work-related injuries.
Well, and the way I look at it is why wouldn't you? And that's kind of why I thought everybody did it, because my boss supported me and the practice was, because if a hygienist had to take a day off because they were sick or they got injured, that's money out of their pocket, really. It's one of those things where if you're spoiled and you don't know it until you know it, and then it's like, wow, I should have been more appreciative.
I do have one question about that, because you did mention the rheostat. How does the feet factor in with using rheostats and changing your gait and all those things you talked about?
Well, in this article, they don't specifically address foot position or rheostats. We just know through other, reading, other pieces of research, or just like our common sense. My problem with rheostats has always been, it's never in the place where I need it. There's cords, there's the back of the chair, there's carts. I find myself changing my hip and knee and foot position to reach rheostats.
Yes, all the time.
So that's the most difficult part. So, for me, I've gone to a cordless handpiece because I don't want another rheostat. In my CE course that I give on ergonomics, I have a picture of my op, and I have lots of rheostats because I have high speed, I have slow speed, I have laser rheostat. So being able to just get rid of one rheostat for me was amazingly helpful, just because I have to maneuver around a lot of rheostats and cords. And then, I don't know, Ward, do you want to talk about the pressure on a rheostat? Well,
yeah, I don't know about the pressure necessarily, but it does change the pressure of the way that you're changing the way that you're moving in order to reach for that. A lot of times it's not, once again, you're taking yourself typically out of that neutral position or that best position, changing the weight distribution on your legs. So sometimes you're compressing neurovascular bundles that are coming through the legs just because you're changing that position a little bit. It's all these little tiny changes that you make in your body that if you can avoid some of these things and try to use, as Lancette mentioned, cordless hand pieces and things like that, that you can modify things and reduce those musculoskeletal injuries, I think is kind of the key.
That's awesome. Thank you for that. Because again, I know there's not a lot of research out there. So thanks for bringing that to us. Boge, what you got?
I'm thinking we have all of this combination of stuff that we give to students to try to help them be ergonomically sound. So my students use headlamps and loops. They have the ergonomic safe gloves. They have sharp and free instruments, different variety of instruments that get exposed to in school. They have the saddle chairs, but the consistency among schools is what I find, there is no consistency. A lot of students, not only do they not have the equipment, but they're not getting exposed to the ergonomic lectures. So I just want to throw out there that there's some great resources available through some of the ergonomic companies that you can go on YouTube and you can watch some of these videos. So if you're not getting that education in your program and you find that, at the end of the day, you're already starting to feel kind of achy, your neck hurts, your back hurts, there's places that you can go and you can reach out to other professionals to help. And I think that's a scary concept for students to grasp, but just know that there's other places that you can look outside of your school setting. And, for some program directors, that's sometimes scary to think about your students getting their education in a format where you can't necessarily control it as much. But I always encourage my students, watch that kind of stuff. And when you have questions, bring it to class and bring it out. Because if you're not talking about it, then you're not learning about it. And so if you're going home every day and you have a backache and you're not telling your faculty about it, there's nothing they can do about it. So bring it out, talk about it, get some help. And by all means, if your faculty knows about it, probably what they're going to do is tell you to go ahead and see somebody like Ward, try to figure out what you're doing wrong. And somebody like Ward, not necessarily Ward, but a physical therapist might be able to, take a short video of you as you're working or be able to look at you and help you figure out what's wrong, because those muscle memory habits, if you develop bad ones, they're going to follow you if you don't fix them right away.
I feel like in school, when I was a student, I got talked to because I have a nice little flexion in my thumb, and they would stay on my, all the time. But I was one of those students also that put my feet on the casters, but no one called me out for that. But dang it, if my thumb was flexed a millimeter in the wrong direction, they were after me. And I was like, can we talk about the bigger picture?
But did anybody ever tell you that the chair that you were sitting in didn't fit your body or help you adjust it?
Girl,
and
no.
see, that's my thing. I'm big, I'm tall, and I need an extra tall caster. And so I didn't figure that out till I was in practice for 12 years. And I had somebody who was willing to provide me with the equipment. So it wasn't a money thing. It was just that I didn't know that until I started working with a company that helped me figure it out.
Yeah, ergonomic tools are not one size fits all. And I've had to try multiple things before I found, the sweet spot. So it's kind of like the Goldilocks story. You have to try different sizes, different shapes, different companies, and find what really makes sense to you. And I think, maybe with students, I remember, even though it was 25 years ago, I graduated. I remember it like it was yesterday. I was in survival mode. I just wanted A's. I wanted to graduate. I wanted to pass boards. I wanted to get a job. And I wasn't really thinking about the whys of all these things, right? Good ergonomics not only help you feel good at the end of the day and prevent injury, but you can be really, really much more effective with your instrumentation as well when you have good ergonomics. So it's the connecting all the dots as to the why, where I think some information is really lacking.
So true. I think this is great because you made good points, Emily. So if you are a student right now and you're listening to this, and this isn't a conversation that you're having in your school, share this with your student, your fellow cohort. Tell a lot of people, spread it in your student associations, and then go and do exactly what you were saying, watch YouTube videos and really dive into this, because you don't know what you don't know. And if you're not talking about it, Emily, you said it perfectly, you're not learning about it. And this is what's going to bring longevity to your career that you are spending so much time and money learning about right now. I do have a question to wrap up. I don't know if this is going to trigger anything, but right now, I feel like as we're all going back from our pandemic quarantine, we are all learning the value of a high volume evacuator and those good old HVACs that I definitely was not taught to use, that I think I'm 17 years into hygiene, and I learned 2 years ago how to use, and I'm still an awkward mess when I do something outside of my comfort zone. I'm slapping patients in the face, and I can feel the drag on my wrist when I don't have my quarties and all those things. So I'm just curious, do you predict that we see any issues from an ergonomics perspective now that we are going to have a lot of veteran hygienists that have not used high volume try to use it as solo practitioners now?
So we implemented PureVac in practice. I don't know. Can I say that on?
Yeah, for sure.
I didn't know if I could say brand.
I mean, if you implemented it, yeah, go ahead.
So we implemented it last August for our students because we had been not paying so much attention to the CDC requirements for high volume evacuation with an 8 millimeter single bore opening or larger, because we couldn't have that indirect vision. And so once we found PureVac, I was actually going between PureVac and then another company out of Germany that was quite a bit more expensive. And the unit from Germany was heavier. And so we went with the one that was lighter. And we haven't implemented quarties yet, but it's on my plan to do that eventually to decrease the cord drag. But I will say, I was really happy that we already had that implemented when this whole COVID thing happened, because it was one less thing our students had to deal with, because now they're dealing with their, the respirator and then the shield all the time. And it's just one less thing to have to worry about.
Yeah, I agree. I had already implemented the PureVac and the Cordies, exact same things way before COVID. So I was set up for infection control success and ergonomic success. But yes, I think, Michelle, to answer your question, I do think we're going to see an increase in pain and musculoskeletal problems, because not only do we have more PPE using equipment we're not familiar with, we're stressed, we're hot. It's a very, very high tense environment. I mean, I am back to work and I'm basically in the hazmat suit. In general and overall, just mental and physical stress and new equipment and stuff. So there's going to be a big learning curve. And I know a lot of ergonomic tools are in back order. Hygienists can't even get them. So they're going to have to struggle for a little while. So, I mean, my gut feeling is yes, we're going to see a big influx, I think, in occupational injury.
Sorry to interrupt you. I already see this week, because these shields that we have, the only shields we could get, you couldn't have a lamp with them. And I'm in my second week of practicing without a lamp. And I tell you what, I could feel it all the way up my neck today.
Yeah.
Yeah. I don't want to live that life. I've said for years, I'd get rid of my loops before I get rid of my light.
Yeah.
And it's going to be tough, but I think, a cord ease, if y'all don't already know about it in the world, CORDE, easy. Okay. Cord ease. Yeah. It's a little bracelet. It's autoclavable. It's great. That made a huge difference on the drag. Again, I was slapping my patients in the face. It's just exhausting. I felt like I was like having this like boa constrictor. I'm like, let me just drape it over my shoulder and it would be easier. So I really do appreciate you guys coming on and spreading the message, because it's one that, again, we don't talk about. And this is the first of the series for July. So I think this is a fantastic way to kick it off. And I appreciate your knowledge and message today.
Well, thank you for having us.
So I would love for you guys to, if you have any place for people to go and ask questions or find out more information, or even like a YouTube that you like, please share with everyone.
Well, you can reach me at my email. It's lancettvg@gmail.com. My website for my CE courses is hygienistforhealth.com. My favorite YouTube video is from Cindy Purdy on how to properly sit in a saddle stool. And it's a YouTube video. So I think Cindy Purdy, how to sit in a saddle stool, was probably the most mind-blowing thing that I've seen on YouTube regarding ergonomics recently, because I've used a saddle stool for probably, 15 years, and I had always been using it wrong. So I learned something tremendously from her.
And you can actually listen to tipisodes from Cindy. Anyone that's hearing this, listen to those tipisodes. And she actually, I think we have linked in some of her tipisodes, the YouTube videos, but she gives you a verbal explanation of how to do it. So check those out for sure.
I also, I'm sorry, Ward, were you going to go ahead?
No, go ahead.
See a physical therapist always for the rest of your life is his advice, because I get routine evaluations, assessments, and exercises and never stop learning.
That's true, actually. I mean, I think that if you're really questioning what you're doing at work and you're going home with, and you realize you're having aches and pains and it's consistent, it's not just related to going home and sitting on your cell phone and looking down, potentially you might have something that you can change at work. And it might be some simple changes even. And even that might be just a simple, taking a video and a picture of yourself or your workstation and say, hey, what can we do differently here? So I would definitely recommend that. I think that that's honestly a very easy way of just looking at what you can do differently for yourself.
That's awesome.
I was actually going to recommend that Cindy Purdy video. So you stole my thunder.
Nice.
Stole my thunder, Lancette.
It's that good, people.
It is. It is good. And I tell you what, Crown Seating has some great information out there just in general about taking care of yourself. And they have some wonderful references on their website.
Definitely. All of us have been to Crown Seating. It's fantastic company with great people. They truly believe in ergonomics and efficiency. And it was really great to learn how the sausage is made there.
That's right.
Well, awesome. Thank you again so much. Definitely reach out if y'all have any questions, but start strong in your career. Start with good ergonomics. It's so important. And just because you might not get a CE credit, if you see that course, take it. It will be so valuable. And I mean, hey, start with Lancettes too. Start there. So thank you.
All right. Thanks.
Thanks, Michelle. See you guys. Bye, Lancette. Bye, Ward.
Bye.
Bye.
We hope you guys enjoyed this roundtable. Thank you to our guests for bringing all their advice and the research that they found for us. And again, follow us on Instagram, follow us on Facebook. You can always go to our website at ATotH.com. We would love your feedback. And don't forget to share this episode and rate and review us on any of your listening apps.
Thanks, everyone.
Bye, y'all.